what do employees look like if they're developing an addiction, or if their addiction is, they're not developing it because it's an adolescent onset. I'm a really typical addict. I was diagnosable by age 17, and it's an adolescent disease. Nowadays, we start at 13, and most of us who are going to get it in our teens, but it doesn't become obvious until much later. So by the time you see it in the workplace, it's getting late. And what do you see? What are some of the things you see in the workplace? Absenteeism. You see episodic. You see erratic behavior. The funny thing about behavior is that their performance might be one of the best. It often is, because we're overachieving often, because we're driven by our guilt and shame. But then it'll get flaky, and you're going to talk to them, and they clean it up. And so there's a lot of erratic. They become moody. They're more likely to be in disagreements with other workers and that sort of thing. So if you are in a management position where you're the manager and you have to do something, you have to do something about it. Testing may or may not be part of policies. I'd like to see it out of policies. I mean, somebody has to determine fitness and safety. The problem with drug testing is it doesn't show impairment. With the exception of breathalyzer, drug testing doesn't show impairment. It's not very useful for that. What's the commonest cause of impairment in the workplace? Fatigue, number one. Yeah, fatigue. And there are actual tests for impairment in the workplace. You can do cognitive testing, computerized cognitive testing, but we don't, for some reason, want to go down that road. The other thing is, it's not like there's good drugs and bad drugs. During allergy season, show me a person who's on antihistamines, and I'll show you a person who's at risk because they're impaired. Okay? Everybody has a responsibility. And ultimately, and this is a take-home thing, that ultimately the determination is a medical fitness determination. If you're in doubt, and it's a highly safety-sensitive position, somebody has to make an occupational health decision. Is this person fit and safe to do their job? And I don't care if the drug is marijuana or alcohol or opioids or prescribed anti-seizure medication. It's all the same. It's a medical determination of fitness. So, but when in doubt, get them out of safety risk. You know, that's called harm reduction. Get them the hell out of there. Stand them down. Okay, so when you think that there's a problem at work and you're the management person, remember, you're dealing with a health issue here. So give them privacy, get a quiet place, mind your own business. And what is your business? Attendance, performance, behavior, and safety. You're not going to ask them about, do you have a problem with drugs? You're not going to ask them about their health issue. You're going to mind your own business. However, you're going to use objective information. I saw this objective thing, and it has to be objective. It's not just a gut feeling. You're going to have an objective thing to confront the person with. Ask them about, is there an explanation for what I'm seeing? If it's indicated in your policy, and I know that can be a policy. I've got a couple of slides on policy. Policy is a joint exercise in development that you address how to go down the road. But I suggest that someplace along the line, an occupational health person needs to determine safety, determine fitness. And it's something that a drug test doesn't do. If you're going to either do testing or get an immediate assessment, stay with the employee until it happens. And if you're sending them home, make sure that you arrange for safe transportation because of the safety risk. Okay. When I started in this field, we didn't use a lot of painkillers like opioids, and that has increased in Canada leads the world in opiate prescriptions. So a lot of people in your workplace, unbeknownst to you, are taking opioids. And understand that the prescribing is decreasing a little bit. So opiates are from the opium. They're like opium or morphine, and opioids just means a synthetic made in a lab like fentanyl or Dilaudid or methadone. Do you know how heroin got invented? Heroin was invented by Bayer, the people that made aspirin. And one of its things, it was a much safer drug than alcohol. It was used as a way to take people off alcohol. How well did that go? Opioids do cause both thinking impairment and psychomotor impairment, and it's measurable. Even long-term opioids, so even when a person's taking a fixed dose and they say it doesn't affect me at all, actually you can measure it. So my next slide shows a little bit. And people on opioids may or may not be fit for safety-sensitive or safety-critical work. It's a determination that has to be made, whether or not it's prescribed medication. The American College of Occupational and Environmental Medicine said opioid use is not recommended for people who perform safety-sensitive jobs. Now that's the American. In Canada, it's not quite as clear-cut, but the reason that I posted to you is because you can't just follow a guideline. You're going to have to get individual cases evaluated individually. Is this person fit and safe to do their job? And for safety purposes and for medical legal. You know, from a litigation point of view, you bloody well want to know, is this person safe? Whose job is it to determine safety sensitivity? It's one of the exam questions. It's up to the employer to determine it, but the health professional doesn't get off the hook. So, although when I see a person in my office, I have to make a determination, but the designation is an employer responsibility. So the employer must to make this, and this was a Canadian Human Rights Commission statement. So if it causes potential harm to the worker, others, or property, it's safety sensitive. In your business, are a lot of jobs safety sensitive? Yeah, not all of them. There's probably some clerical ones that aren't, but I remember when I used to work with Fraser Surrey docks, the stenographers, which we used to have in those days, were considered safety sensitive because they had to walk under the gantry cranes to get to their office. So, okay. People who smoke marijuana are more likely to, and I know that Justin would not like me showing the slide, but people who smoke doobies are more likely to be involved in accidents, injuries, and absenteeism. That's regular pot smokers, regular marijuana smokers, people who smoke regularly, okay? The Canadian Occupational Health Group, the Occupational Medical Association of Canada, 2018 guideline says that cannabis is a sneaky drug because it's fat soluble. And the brain is mostly fat, or it's got a lot of fat in it. And so the effects of marijuana are long acting. And so although you can measure it in the body for 24 hours, the measurable impairment can be longer than that, depending upon a number of factors. Okay? So this is looking at the various forms of testing, oral fluids, urine, and hair for different categories of drugs. And with an obese person who smokes a lot of marijuana, you can measure, I've measured urinary THC carboxylate, the molecule that you measure in the urine, and I've seen it up to 80 days after the last use of the drug. So the problem is that there isn't a reliable measure. So when you're determining, if you're the employer or you're the safety person, and you're saying, what's our policy going to be in this safety-sensitive, safety-critical workplace for people who smoke marijuana on their own time, you got a bit of a problem. Okay? I'm sure that a lot of you have given that some thought. So, what's the take-home message then? If opioids can cause long-term impairment, if marijuana can cause long-term impairment, if your workplace is safety-sensitive, safety-critical, how do you manage it? Okay. And it's not just management. You know, it's everybody's responsibility. That's why I loved working with the IWA. IWA drove this hard-ass policy of you know, get well or get gone, because everybody's life is at stake in the bush, in the forest. And everybody shares responsibility. So safety is the predominant driver here. And what I would say, if in doubt, have a health, either a really good occupational health nurse or a really good physician, preferably an occupational physician who knows the issues, who can give you guidance on a case-by-case basis. Otherwise, it's a nightmare. Okay. I know that our next speaker is going to be talking about a little bit more about mental health in the workplace, and these are determinants of mental health in the workplace. And the reason I'm going to quickly go through them is a mentally healthy workplace is a happier, more productive workplace. It's a safer workplace, but it's also a place where it's easier to recover if you've got your addiction is less likely to continue to be a problem. So there's clear and consistent leadership. There's a culture of honesty, respect, and civility. People are actually doing jobs that they can do, rather than the Peter Principle. Workers are honored and asked for input into decisions on how to do the job best. There's actually a chance of advancement. People's time off is respected as being an important part of health. And there's some kind of recognition for doing good work. And I've seen lots of that here today. So those are the evidence-based determinants. They identified 13 of them, but I teased it down to this number as being, if you've got these things, if you can tick those off in your workplace, you've got a pretty nice place to work. Now, what does a recovery-informed workplace look like? Well, the top right corner is just what we went over. The next one beside it is that there's a collaboratively developed policy that addresses substance use, what's okay, what's not okay, how we deal with it if there's a violation of policy, but also how we deal with it if a person has a mental health or an addiction problem as far as accommodation and return to work. We're going to do some education and training to destigmatize the problem. Most people with addiction can and do recover. That's how the early EFAP programs got started. That's how this industry in BC had such a good employee and family assistance program. There's respect for medical privacy. Addiction is just treated like any other medical or health condition. People are accommodated And some workplaces actually honor people in recovery by giving them a place where they can meet, or honoring their going to meetings and sort of thing. What's the whole package look like? If I'm a recovery-friendly workplace, I'm going to have the components of a mentally healthy workplace. I'm going to support my recovering workers. I'm going to have a policy. I'm going to educate people about my policy and about addiction and about recovery. I'm going to have occupational health and employee and family assistance program, people that are really skilled in addressing addiction. And I'm going to treat it with respect, dignity, privacy, and you do have employee and family assistance program.